Hello viewers, Namaste. A very good afternoon. Welcome to our Facebook live session. And all we know that today is International Nurses Day, and we are reminded of the risk nurses are taking for us during this COVID-19. And thank you nurses for treating our patients and with your understanding and your professionalism. And today we have our radiation oncologist, Dr. G. Avilash, joined us for the live session, and he will be explaining us regarding the topic head and neck cancer radiation. And if you have any queries regarding this, you can drop us the message in the comment box. We will take them during the live session. Welcome, doctor. Welcome to our Facebook live session.
Thank you, Anuja. Namaste. Hello to all of you. I just want to introduce myself. I'm Dr. Avilash. I'm a junior consultant in the Department of Radiation Oncology in Apollo Health City, Visakhapatnam. Including my MD training, I totally have 7 years of experience in radiation oncology and cancer management care. And today I would like to talk about head and neck cancer radiation. I have chosen this topic because in India and among the male population, head and neck cancer is the #1 cancer, and it is still much prevalent in India, mainly due to the extensive tobacco usage. And I would like to talk a little bit about this, and also how the COVID pandemic has disrupted our healthcare services, and a little about how we can provide the optimal cancer care.
Thank you, doctor. Doctor, coming to our first question, what is head and neck cancer?
Yes. So head and neck cancer means the cancers which involve the oral cavity or the mouth, or the oropharynx or the larynx. They are parts of the throat and the voice box. So if you go to an ENT doctor, they examine the ears, nose, throat generally. So any cancers which are related to these structures, they come under head and neck cancers.
Thank you, doctor. And our second question is, what causes head and neck cancer?
So the most common cause of head and neck cancer is tobacco, use of tobacco. So if you look at globally, head and neck cancer is not such a prevalent cancer. But when it comes to India, as I said, the males, it is the #1 cancer in males in India. So tobacco usage in any form is the main culprit which causes head and neck cancer. So it can be smoking cigarettes, or it can be smoking BDs. It can be usage of khaini, zarda, pan masala, gutka. Any form of tobacco is the primary culprit. Alcohol intake can also aggravate and act as a catalyst in causing head and neck cancer. So the most important point I would like to emphasize here is one cigarette. They have analyzed, many studies have analyzed the components within cigarettes. One cigarette has 72 harmful substances. They are called carcinogenic substances. So you can just imagine, in one pack of cigarette there are 20, and there are many people who smoke, a packet a day easily for many years. So you can just imagine the damage which one cigarette can cause to your body. And also I would like to emphasize that head and neck cancer is not the only cancer caused by cigarettes. A total of 19 cancers in the entire body from head to toe are caused by tobacco.
Thank you, doctor. Doctor, what are the most common complaints of head and neck cancer?
Yes. So head and neck cancers, unfortunately, in India, they present at a later stage. I will tell you why. So for any cancer, there is an early stage and there is a late stage. And the symptoms or the complaints which patients or people generally have, or which they ignore in the beginning, are a small growth or a small ulcer in the mouth, or they can have a painless swelling in the neck region. It does not cause any pain. It will be very small in the beginning and it is painless. So patients generally tend to ignore. And also in our country, tuberculosis or TB is a very prevalent disease. Tuberculosis also presents as neck swellings. So patients are sometimes misdiagnosed diagnosed and they are put on TB treatment. And also one of the third, bleeding, any form of bleeding from the mouth, from the nose, or while coughing can also be an initial symptom. Weight loss. So in spite of patient, first they will have loss of appetite. They will not feel hungry. They will not feel like eating a lot of food. And because of that, they will have weight loss. That is also a symptom of cancer. Then change in the voice. So we have something called a voice box, how we speak. The technical term for it is called the larynx. When there are cancers which involve the larynx, you can have a change in the voice or a hoarseness in the voice. So these are some of the most common complaints which can come before a complete cancer diagnosis is achieved. So again, I just would like to remind the symptoms. Any ulcer or growth in the mouth, painless neck swellings, sometimes ear pain can also happen, change in the voice, loss of appetite, weight loss, and any kind of bleeding from the mouth, nose, or throat.
Thank you, doctor. One of the viewers, Prashad, asked the same question. I hope his doubt has been cleared.
Yes.
So coming to the next question, what are the different treatment options available for head and neck?
So before we jump into treatment options, I would like to just talk about how we can diagnose head and neck cancer. So these are the symptoms, or they are called presenting complaints. So whenever a patient or any person has these complaints, they first present to an ENT doctor, ear, nose, throat doctor. They will do a thorough examination, and if a cancer diagnosis is made or suspected, they have to be referred to oncology team. So that is what we have here in Apollo Hospital. We have a dedicated oncology unit with a surgeon, a surgical oncologist, a medical oncologist who deals with chemotherapy, and a radiation oncologist, which is my department, which deals with radiation. So how do we diagnose this head and neck cancer? Is, I think, what Mr. Prasad has also asked, how to identify, is a question we have got. So first we do a thorough history and clinical examination. So by history, we ask the patient what are his symptoms, since when does he have them, what are other associated complaints, and a clinical examination. So we have various instruments through which we can examine the oral cavity of the mouth, the nose, and we have endoscopy examinations with which we can examine the throat and the larynx. So after a history and complete clinical examination, we do some basic blood investigations to make sure the blood parameters are all within check. And we do a thorough nutritional assessment also of the patient to see how his nutritional status is. Then we do a dental checkup also to make sure there are no infections, etc., which can aggravate cancer and further cancer management down the line. And then we have to go for an endoscopic procedure and a biopsy. A biopsy is just taking a piece of that growth or ulcer or abnormal tissue, which can generally be identified on an endoscopy examination. Also, we have further examinations or investigations like CT scan of the neck, MRI of the neck, and in some special situations, if it is indicated, we can go for a PET scan as well. So these are the diagnostic workup or investigations which can help identify head and neck cancer.
Thank you, doctor. Doctor, what is radiation therapy?
So coming to radiation therapy, why specifically are we talking about radiation therapy? In head and neck cancer, there are different modalities of treatment. There are mainly three of them: surgery, chemotherapy, and radiotherapy. Also, as I said earlier, cancer will either always be early stage or late stage. So in early stage, a single modality management is used. And by single modality, I mean either surgery or radiation can be used. When it is advanced or slightly later stage, if it is diagnosed, which is commonly the case in India, we have to use a multi-modality management. It is either a combination of surgery and radiation or radiation and chemotherapy, and we use it in varying indications. So what is radiation therapy? To simply explain, radiation therapy is actually treatment with high-powered X-rays. So if you have some cough or cold, or if you go to a general physician, they generally advise a chest X-ray. And you get the film and you can see the chest, the ribs, the heart, lungs, etc. So it is the same X-rays, but which are very high-powered, and they are used to treat or kill cancer.
Thank you, doctor. Doctor, what happens during radiation therapy?
Yes. So we have some very high-end equipment through which these high-powered X-rays are generated and delivered to kill or combat cancer. So the equipment which is used in radiation therapy is called a linear accelerator. So if you can just Google it or go to YouTube and type linear accelerator, you will see a very big and fancy machine equipment which is used worldwide for this. We here at Apollo Health City have the latest state-of-the-art radiation therapy equipment, which is the TrueBeam STX linear accelerator. It is definitely one of the most pristine and high-end machines we have in the world, not only in our city or our state or our country. So this is the same machine which is used on a global level, and we are very happy and proud to have that in our arsenal to fight cancer.
Thank you, doctor. How long does radiation treatment last?
So this is the catch here, and it's very relevant to the present COVID pandemic also. So as I said, radiation therapy lasts for at least 6 to 7 weeks. Radiation therapy is not a one-day treatment. For example, surgery, you come in, investigations are done, you are admitted, surgery is done. After surgery, you are in post-op care and you are discharged. In chemotherapy also, you get some blood tests done, you get admitted, administer the chemotherapy, and then you are discharged in a day or two at the max. But unfortunately, radiation therapy is not a one-day treatment. Radiation therapy happens every day. It happens 5 days a week from Monday to Friday. Saturday, Sunday is an off, or we do not give radiation on Saturday and Sunday. And it goes on for 6 to 7 weeks in head and neck cancer. Why is it like this? It is based on the biology or the head and neck cancer biology. And there are something called radiobiological principles which govern how radiation affects the body, how radiation affects the tumor, and how it kills the tumor. Based on all these principles, a time duration of 6 to 7 weeks is essential for treatment of cancer through radiation.
Thank you, doctor. What are the side effects during after the radiation treatment?
Yes. So just remember that no treatment in the world is without side effects. Even when we have fever, when we take a paracetamol tablet, that also has its own set of side effects. But that does not mean that everyone who uses it will have all these side effects. Every patient is different, every cancer is different, and how patients respond to treatment is also different. So I would like to enumerate some of the side effects of radiation therapy. And there are side effects, but I would like to first emphasize that all these side effects are controllable, manageable, and temporary during the course of radiation treatment. Once the radiation treatment is completed, all these side effects will slowly dissipate or reduce. And in spite of that, if some patients there are side effects, we can successfully manage it. So some of the possible side effects are, radiation basically enters the area, the head and neck area, through the skin. So number one, there will be some skin discoloration. There will be some skin darkening or blackening. Again, it is temporary. And once the treatment is over the next few weeks, it will slowly dissipate. Also, because radiation, we give it in the radiation passes through the mouth and the throat, and there can be some oral ulcers. It is also called oral mucositis. So because the mucosa of the oral cavity is exposed to the outside world, radiation will have some effect on it and causes some ulcers. For that, we have symptomatic management like medications and some oral ointments, which can help control this. Apart from that, there will be some difficulty in chewing, eating, and swallowing food. So for that, we have a definitely nutritional assessment, which I mentioned in the beginning, that is done before treatment. And also we have a dietitian and a customized diet plan with nutritional count and calorie intake is made. A customized plan for each patient is made. And also every patient, generally head and neck cancers, they come in age group individuals who are generally 60, 70 years old. And in India, most of our patients have other problems like BP, sugar, asthma, etc. So simultaneous medications are running for these conditions as well. So we make a customized nutrition plan so that we can cater to all conditions, so that we can maintain the nutrition of the individual.
Thank you, doctor. Why should I opt for radiation and not for the surgery in head and neck cancer?
Yes. So as I said, the management is a single modality in early stage head and neck cancer. So for example, stage 1 and stage 2, in any side of the head and neck, we can do either surgery or radiation alone. But in other sides, like the throat or the voice box or the larynx, as I mentioned, surgery will be very difficult to do. Why? Because surgery will entail removal of the cancer and also a bit of the surrounding tissue. So that will actually cause a lot of morbidity during surgery, and post-operative complications can also be a lot more. And also there is actually disfigurement. I mean, we are actually putting a blade and cutting open the neck, removing the cancer. And again, yes, we are reconstructing that part. We have our very capable surgeons and plastic surgery colleagues who do a very good job. But the disfigurement is definitely there. So why you should opt for radiation and chemotherapy treatment in some cancers, like the cancers of the throat, is there is a concept called organ preservation. So organ preservation means we are the natural anatomy of the neck, or how the various structures in the neck are, they are preserved, and their function is also relatively well maintained without having to cut open and remove and cause cosmetic deformity. So organ preservation is a concept which has actually come up very rapidly in the last 2 decades. And head and neck cancer is a prime example of where we can try our best to cure the disease while preserving the organ and its function.
Thank you, doctor. What is the role of chemotherapy in head and neck cancer?
Yes. So chemotherapy also has a role, as I mentioned, in multimodality management. Radiation, as I said, is given for 6 to 7 days. Radiation is given Monday to Friday, 5 days a week. Chemotherapy is given once a week. So among Monday to Friday, once a week, we will give the chemotherapy. What it does is, there is a concept called radio sensitization. So chemotherapy basically acts to improve the effect of radiation. So it is like a sidekick, or it is like a partner who helps us beat cancer more effectively. So there are complex mechanisms underlying this through which it acts. And also the chemotherapy dose is very less when given along with radiation. So patients do not have to worry or become anxious about chemotherapy. There is a general anxiety related to chemotherapy, but the dose we give here is extremely less. And also the other supportive medication and monitoring will also be done when chemotherapy is given.
Doctor, one of our viewers is asking, like in stage 1, after the patient has recovered, is there a recurrence of this disease?
That's a very relevant question. So number 1, stage 1 cancer. Unfortunately in India, as I said, early stage cancer is stage 1 cancer. Patients generally do not present to the doctor or the hospital when it is a stage 1 disease. Why? Because they do not have symptoms and they generally are anxious about going to hospital, getting investigations done, etc. But I'm sure there are many of you who are out there who are very aware and go as soon as there is some health issue. And yes, we have also seen stage 1 cancers who have presented to us and treated them. So when we radically treat a stage 1 cancer, the chances of cure are more than 90%. This is broadly speaking. And the chances of recurrence generally only happen if, in spite of cancer treatment, the patient or the person involved does not, say, quit some habits like smoking, does not take care of his oral hygiene, does not come to regular follow up to the doctor, and is out of touch with the hospital or the doctor. Once a patient is diagnosed with cancer, once a patient is treated with cancer, irrespective of stage, a follow-up is definitely essential for at least the first 5 years after completion of treatment. So we have a recommended follow-up protocol which is there and is practiced more or less worldwide, and we also follow the same protocol. So diagnosis and treatment is one side of the coin. Follow-up is undoubtedly the other side of the coin. If you feel that treatment is done and we do not have to go to the doctor, we are fine, sure, you may be fine, but along the run, there could be some issues, which could crop up. So a follow-up is absolutely and undoubtedly essential.
Thank you, doctor. What is the impact of COVID on head and neck cancer, radiation, and its management?
Yes. So the reason for me to choose this topic for the live session today is also because head and neck cancer is such a cancer where the cancer management cannot be avoided or stopped or delayed for a long time. So from the head to toe, we have various body parts, and in any body part, a cancer can arise. But in some parts, there are other alternate treatments which can delay the onset, delay the cancer, or it can delay the onset of definitive treatment. But unfortunately, head and neck cancer does not fall in that category. And also because head and neck cancer in India in males is the #1 cancer because of our prevalent tobacco and alcohol intake, and also because of lack of education and awareness, patients generally present very late in advanced stages. So the treatment of head and neck cancer is very much essential. So, and also there are international guidelines which have been published in the last week of April regarding head and neck cancer. The American group ASTRO and the European group ESTRO have published a combined guideline outlining a strong indication for the continuation of cancer care management, especially in head and neck cancer. And also the government of India has exempted cancer, has definitely ensured that cancer treatment has to continue. We see nowadays that a lot of hospitals, nursing homes, etc. are closed, are not functioning, OPDs, etc. But the cancer care definitely has to continue, because cancer does not wait for COVID to reduce or disappear. Cancer has a mind of its own. It will continue growing if it is not addressed with the optimal cancer care. So which is why head and neck cancer definitely has to be addressed in spite of the COVID pandemic.
Thank you, doctor. Doctor, what are the precautions can one take to ensure proper and timely completion of the treatment?
Yes. So again, as I said, the treatment of head and neck cancer is slightly drawn out. It is a long treatment, 6 to 7 weeks. Patient has to come every day to the hospital, Monday to Friday. Patient will receive radiation every day. Patients will get chemotherapy once a week. And the side effects of radiation and the side effects of chemotherapy will be monitored and have to be managed. Another very important thing I would like to emphasize is, once the treatment starts and when the patient comes for radiation to the hospital, you will spend an average of maybe 1 hour, 2 hours maximum in the hospital. And the remaining 22, 23 hours are spent at home along with your family members. So, and this has to be continued very diligently and thoroughly for 6 to 7 weeks. So counseling and emotional support and a positive environment at home is extremely, extremely crucial for all cancer patients, and especially head and neck cancer patients who are undergoing treatment. So what are the possible precautions you can take to ensure timely completion of treatment. So once the radiation therapy starts, I personally make sure that I counsel all my patients. We sit for at least half an hour to 40 minutes, running through all the major points which have to be carefully ensured at home and at hospital also. Straight away, I would like to start off with the COVID precautions because that is extremely crucial and essential. And also patients who are undergoing treatment with radiation and chemotherapy are prone to infections. And also COVID is another big player out there which can cause more damage to us. So the main three COVID precautions are hand washing. Please wash your hands frequently and regularly with soap and water or some disinfectant. Everybody should do this very regularly. Number two, head and neck cancer patients and also their family members or supportive relatives, friends who are coming along with them to the hospital, please use a mask. A surgical mask or a cloth mask, anything can be used to prevent or decrease the risk of infection. Number three, social distancing. I'm sure all of you are aware of social distancing. It is rampantly being spread, the message is spread on TV, news, radio, social media, wherever we go. Please follow social distancing. So these are the first COVID precautions. Number two, when it comes to head and neck cancer, as I said, there will be some skin discoloration during the treatment, which is temporary, for which we can give some steroid-based creams or ointments, and we explain how to use them and how frequently to use them. Oral cavity care in the form of brushing at least twice a day, morning and evening before going to bed, and also oral gargles. Please do not use any mouth washes like many are available in the market, Dettol, Clorox based. They are all some alcohol based solutions. They may not be that protective in head and neck cancer treatment. So oral gargles with just a glass of water, a pinch of salt and a pinch of baking soda can completely cleanse the oral cavity and keep it clean and hygienic. Gargles have to be done at least 8 to 10 times a day. Number three, drinking plenty of liquids. Water is the best liquid out there. So drinking plenty of liquids during treatment helps reduce the side effects and also long-term toxicity is reduced. Number four, nutritional care. So as I said, we have a dietitian in our hospital also. We can make a customized diet chart, taking into account any other problems also you have like sugar, BP or anything else. And we can make a customized diet plan for you, making sure you are getting the adequate amount of calories. And also there is diet modification. So the patients cannot eat cannot take meals like you and me or other normal people. So they will have to take more liquid-based, semi-liquid based, juices or other, calorie-dense foods which can easily, go down in spite of the continuing cancer treatment. And we encourage steam inhalation for patients for 4 to 5 times a day. Steam helps in reducing the edema or the swelling which is present in the throat. And chemotherapy precautions. Chemotherapy also comes with its own set of side effects. So for that, there are some medications. With chemotherapy, generally, vomiting is a main side effect. So before chemotherapy and after completion of chemotherapy, there are IV drugs and also oral tablets which we can give to reduce these side effects. And there are other side effects also, saliva. So when you need saliva to chew the food, eat the food. So there is already difficulty in chewing and eating food in head and neck cancer. And because radiation is given to the neck region as a whole, the saliva which is produced becomes thick and it causes problems, which is why we encourage oral care, water intake, gargles. There will be some long-term complications of therapy also. They can only be reduced to a certain extent. They may not be able to completely we won't be able to completely eradicate these problems, like loss of taste. Because the salivary glands receive radiation, there will be some altered taste sensation. And in long-term complications, you could have a slight change in the voice. It is called edema, laryngeal edema. for which steam inhalation and other medications can also help. So these are some of the common side effects or complications during treatment and after treatment that we encounter in our daily practice.
Thank you, doctor. Another viewer, D. Reddy, is asking,
Yeah.
what are the symptoms of neck cancer?
Okay, so we had earlier just enumerated this, but I'm happy to enumerate them again. So head and neck cancer generally has symptoms in the form of any growth or ulcers in the mouth, which is also called the oral cavity. Generally, they present after years and years together after when patient continues to keep smoking, etc. There are changes in the body which cause abnormal growth or ulcer. And from these growth or ulcers, one can have bleeding sometimes. If there is bleeding, they generally run to the doctor and present, and that's how we get to know about that there could be cancer. There are painless swelling in the neck. So painless small swelling, they are first small in size, which is why most of the patients ignore and do not go to a doctor. Or they go to a doctor and sometimes TB is suspected and they are put on TB medication. But when the TB medication does not work, if it is not TB, the neck swelling will slowly increase in size. And when it increases in size slowly, you will have pain. Once there is pain, the patient comes generally running to the doctor saying that there is a lot of pain, etc. You can have ear pain also. So at the back of the throat, there is a connection to the ear. So if there is any growth or any abnormal ulcer there, it can cause ear pain. So the voice box or the larynx, as we have, that is how we talk, all of us talk. It can, if there is a growth there, there is change in the voice. It is called hoarseness of voice, abnormal voice. That can also be a sign of head and neck cancer. And also once there is cancer, appetite is decreased. Patients do not feel hungry. They do not feel like eating. So because of loss of appetite, there will be weight loss. So these are some of the common symptoms of head and neck cancer.
Sir, another viewer is asking, his father, age is 68, cancer at left upper jaw, local metastasis to submandibular gland, operated, radiotherapy completed, no residues remain, but extreme headache, jaw become joint.
Okay, so first of all, Adnan, I would like to first, I'm very happy to know that your father has completed the treatment and there is no residual disease. So I'm very happy about that. So an optimal cancer management has been done. But the extreme headache and the jaw becoming jointed, as you have commented, are side effects of the treatment. So as I said, treatment always comes with its own set of side effects. And the main aim of radiation and chemotherapy in head and neck cancer is cure the disease, spare the normal tissue. It is always a balance between these two. So for curing the disease, we have to give or achieve a particular dose of radiation that is spaced out over 6 to 7 weeks. But when we provide radiation, the surrounding normal tissue, or in this case, your father's jaw area, also receives radiation. So the normal tissue over time, it heals or becomes normal. And the tumor tissue or the cancer is killed or is, it dies. There are other supportive treatments like physiotherapy, jaw stretching exercises, jaw opening exercises, etc., which can help, in your father's case maybe, cause increased motion or opening of the jaw, which can slowly reduce his jaw problems and the headache problems. Unfortunately, as I said earlier also, our patients in head and neck cancer present in 6th to 7th decade. So your father, who is 68, fits the bill here. So a 68-year-old man, already after treatment, he will have treatment-related side effects, which is why I said that follow-up is extremely essential. In follow-up, we can advise or send you over to the physiotherapy or occupational therapy departments, which can teach you some exercises which have to be continued at home. And a slow follow-up can ensure slow and gradual recovery. As I said, it is not a one day, it's not magic, or as soon as treatment is over, we cannot expect that everything will be back to normal, because there is already abnormality in the form of cancer. And also we have treated it with, like treatments like surgery, radiation, etc. There will be some treatment related side effects, which may not completely or 100% go down. But there are supportive services which, when done diligently, can reduce these side effects.
Thank you, doctor. Can head and neck cancer be cured with radiation?
Yes. The answer to that is yes. So there are specific conditions where head and neck cancer can be cured with radiation. As I said, early stage cancer, stage 1, stage 2, where we use a single modality treatment like surgery alone or radiation alone. So when it comes to these two options, sometimes patients are afraid of surgery, or they are not fit for surgery because they have other issues like BP, sugar, etc., for which they may not be fit. And also the age group, 68 to 70-year-old, is a high risk age group where sometimes surgery cannot be done. In those patients, we can definitely go ahead for radiation. I have personally seen patients who are of early stage larynx cancer. It is also called glottic cancer, or the cancer mainly of the voice box. Early stage cancers of stage 1 and stage 2, where radiation alone is a treatment which is used and no chemotherapy is used in early stage. We have seen patients who have completely cured because of only radiation and who are on long-term follow-up with us. And as I said, the cure rate for early stage cancer is above 75 to 80%. So if we take 10 patients with early stage, for example, say larynx or voice box cancer, and we treat them with radiation alone, out of 10 patients, 7 to 8 patients will have complete cure. Complete cure. Yes. Radiation can cure cancer in early stages.
Coming to the survival rate, what is that percentage?
Yes. So always in cancer, we talk about survival. So as soon as a cancer diagnosis is made, I'm sure the first question which runs in all of our minds is, what is the lifespan? After treatment, how long will he or she live? So there are numerous trials which are done, international studies, Indian studies. And because in India, head and neck cancer is the #1 study, the Tata Memorial Hospital, where I also did my training, has done extensive studies to see how head and neck cancer is cured, or what are the figures related to head and neck cancer. So broadly speaking, again, we will talk in terms of early stage and late stage. So early stage cancer, again, we talk about in terms of 5-year survival, 5-year overall survival. So the 5-year overall survival in early stage head and neck cancer is above 75 to 80%. So in early stage, we will use a single modality, or in some stages, if required, we will use multi-modality treatment. And the 5-year survival is above 75 to 80%. But when it comes to late stage or advanced stage cancers, that is stage 3 and stage 4 head and neck cancers, again, I want to emphasize that they present very late to the hospital or to the doctor. And by the time they present, and by the time we optimally complete the treatment, in spite of a full, complete, adequate oncological treatment, multimodality treatment, the 5-year survival in locally advanced or late stage head and neck cancer is only 45 to 50%, 55%. So if we take 10 patients with late stage head and neck cancer, only 4 to 5 after 5 years will have cure of the disease. It is just the nature of the disease that reduces the 5-year survival because of late presentation.
Thank you, doctor. Doctor, what are the follow-up strategy in head and neck cancer?
Yes. So follow-up, as I said, is the other side of the coin. Diagnosis, treatment is one side of the coin. Follow-up is the other side of the coin. In follow-up, for the first 2 years after completion of treatment at least, the follow-up has to be done every 3 months. So every 3 months, we request the patient to come to the treating doctor for a routine checkup. So sometimes if indicated, we will do investigations, but otherwise mostly it will be just a clinical examination. How are you doing? Any complaints? And we will just examine the oral cavity, or if the disease was in the throat, we will do an endoscopy examination to make sure everything is okay. Treatment related side effects, as previously we had addressed, one of our viewers, father had jaw becoming jointed, headache, etc. So some patients will have long-term side effects, like altered taste, some difficulty in swallowing, some difficulty in speaking. Again, these are minor issues, but definitely from our point of view, they may be minor. But from the patient and their family's point of view, they may not be a minor problem. So we will address all these issues in follow-up. So as I said, the first 2 years after completion of treatment, every 3 months, the patient is expected to come for follow-up. For 2 years after completion, if patient is completely all right, getting better, the nutritional status is improving, his lifestyle is improving, he has reduced or quit, not even reduced, he has to quit, ideally, quit smoking, alcohol, etc. Then after 2 years of treatment, we can slowly increase the duration of follow-up. Then we make it once in 6 months. So once in 6 months for 5 years. 0 to 2 years, 3 months, and 2 to 5 years, 6 months. And after 5 years, we have also seen many patients like that. After 5 years also, if everything is all right, we put them on annual follow-up. Annual follow-up means once a year. And also, irrespective of the follow-up strategy or protocol in place, if the patient has any other issues, any other problems, he can at any moment or any time present to the doctor, and we will definitely have a look and take it.
Thank you, doctor. How can people who have had head and neck cancer reduce the risk of developing second primary?
Yes. So I would first like to explain the concept of a second primary. So a second primary is a second cancer which comes in the head and neck treatment region, which is different from the initial site of cancer. So for example, if one patient has come to us with a cancer in the throat, after treatment or in follow-up, that patient again comes with a cancer in the mouth. Or it can be a combination of various sites. It can come in any site of the body. So number one, whenever this happens, first we ask the patient if he has been continuing to smoke or take tobacco in any form, or is he consuming alcohol? Is he taking care of his oral hygiene? Is he on regular follow-up with the doctor and the patient? If he is not following all these precautions, we will counsel them and advise them that it is essential that to follow these to prevent further cancers. Because the root cause, as I said earlier, was 95% of the causes are due to smoking, tobacco, etc. There is another concept called field cancerization. What is field cancerization? So when there is a cancer in the head and neck area, and when we treat that cancer, when we treat it with, say, surgery, radiation, chemotherapy, different modalities, another cancer can come in another area due to the inherent biology or the inherent nature of the disease. That is called field cancerization. So when this happens, or if this happens, again, we will address the new area or the new site, again with the 3 modalities we have, which is surgery, chemotherapy, and radiation, and make the best possible customized oncological treatment plan for the patient.
Thank you, doctor. As today is International Nurses Day, so can you tell a few words about our healthcare warriors?
Yes. So it is extremely, extremely important, and I'm actually very fortunate or lucky that today I'm doing this live Facebook session, and today is International Nurses Day. So May 12th, 2020 is International Nurses Day. And it is the theme of the year 2020 is nursing the world to health. So when you come to a hospital, you probably only consult the doctors and get the investigations done, etc. Get your treatment done and you leave. But you have to understand that behind every doctor, there is a whole team of people who help get the management or the treatment done. And our right hands or our sidekicks in treatment are the nurses. So a nurse's job is not only just to, fill out your prescriptions or, just administer your medication. Nurses are the front line, the actual literal front line healthcare workers who are working 24/7 in the operation theaters, in the wards, in the OPs, administering medications, taking care of patients, following up patients. They are an essential, indispensable part of the healthcare network. So in countries, if you look at the WHO reports, worldwide, there is a shortage of at least 6 million nurses worldwide. And more so in low middle income countries and middle income countries. India kind of falls into that bracket. And the COVID pandemic is a stark reminder of the vital role of nurses. So if I talk only about oncology and head and neck management, which is the topic of this seminar, post-operative care, chemotherapy administration, reviewing patients weekly is all a part of nursing care. In India, how did this concept arise? If you just Google about International Nurses Day or Nurses Day, Florence Nightingale is a British social reformer, and she is considered the founder of modern day nursing. And today is actually the 200th birth anniversary of Florence Nightingale. And in India also, the President of India every year on International Nurses Day administers an award to our elite nursing healthcare professionals, which is the National Florence Nightingale Award. And also, there is a lot to learn from nurses. When in my MD training and also in my undergraduate MBBS training, an experienced nurse or a senior nurse is much better than or knows more than a junior doctor who is in training. And if you see worldwide also, nurses are in charge of resident training, undergraduate training, etc. So they play an undoubtedly important role. And on this day, I'm very happy to wish all the nurses who I have met and who have trained me and who I have been associated with a very happy International Nurses Day. Please keep doing what you do. And we cannot do our work without the nursing staff.
Thank you, Doctor. Thank you, viewers, for watching us. If you have any doubts related to this, then you can comment us on the comment box. We will address them on our next live session. And in case of emergency, please call to our emergency helpline number, that is 1066. Thank you.